So moving on to papillary carcinoma of thyroid. This is commonly seen in females and the age group is between 20 to 40 years. What is the most important risk factor? Exposure to radiation in first 2 decades of life. The common site is thyroid, but also the areas where you get ectopic thyroid tissue. Where do you get the ectopic thyroid tissue? In thyroglossal cyst or in ovarian tumors, which has something called as stroma ovari. What is the origin? As I already told you, it is benign follicular epithelial cells. So it is follicular epithelial cells. And what is a precursor lesion? There is something called as papillary microcarcinoma, which will have all morphologic features related to papillary carcinoma, but the size is less than 1 centimeter in size. Very, very important. When size is less than 1 centimeter in size, you are going to call it as papillary microcarcinoma, and that is the precursor lesion for papillary thyroid carcinomas. In clinical presentation, most of the times the patients are asymptomatic and the lesions are detected incidentally on imaging, but sometimes they present with lymph node metastasis as a first sign of underlying papillary thyroid carcinoma. So remember that the route of spread is through the lymphatics, so there is lymph node involvement present in case of papillary thyroid carcinoma. Moving on to the gross, it can be unifocal, multifocal, it can involve both the lobes or it can involve the single lobe. So here you can note that this granular circumscribed area is an example of papillary thyroid carcinoma. Here also there is a whitish, or pale colloid stained area which is sharply demarcated from adjacent normal appearing thyroid. You can see calcific specks, and once there is abundant calcification within the tumor, when you cut it you will get what is known as a gritty sensation. Okay, and because of presence of papillae, the cut section appear as granular in many cases, and sometimes it is entirely cystic with focal papillary excrescences. So there is wide morphologic variation in the gross appearance of papillary thyroid carcinoma. Most important for you student is to appreciate the morphology of papillary thyroid carcinoma, because many a times this is going to be a image based question. So what are the factors that you need to appreciate here? The presence of papillae, very, very important, and they have got the central fibrovascular core. Remember students, papillae with central fibrovascular core. Now appreciate the cells which are lining the papillae. Okay, this is important. There are places where you see nuclear overcrowding. And at this power, you are able to appreciate one more nuclear feature, which is the optically clear nucleus, or the ground glass appearance of the chromatin. Right, this is called as the orphan Annie appearance of the nucleus. Very, very important. It's based on a comic, right? She has an empty eye appearance. So that is compared to the optically clear nucleus of the papillary thyroid carcinoma. Now the other important features here is the intranuclear grooves. You can see here there is an intranuclear groove which is better appreciated on cytology like this. Longitudinal intranuclear grooves are the characteristic nuclear features of papillary thyroid carcinoma, and a characteristic intranuclear eosinophilic inclusions. Remember this. Intranuclear inclusions. Because they are extension of the cytoplasmic things which gets invaginated into the nucleus, they are actually intranuclear cytoplasmic inclusions, or they are also called as incies. Okay. The other important feature is presence of these samoma bodies amidst the tumor cells. Very, very important feature of papillary thyroid carcinoma. You can see here, this is a feature of dystrophic calcification which is present in case of papillary carcinoma of thyroid. So when this question comes, you also need to remember at least 2 or 3 lesions where you expect the samoma bodies to be present. Students, please remember meningioma and serous carcinoma as the important the differentials for the presence of psammoma bodies. Okay, there are many causes. Try to remember meningioma and serous carcinoma of the ovary at least. Now let's just summarize the nuclear features as well as the morphologic features in the microscopy of papillary thyroid carcinoma because it is very, very important. So what did we see there? Papillae with fibrovascular core. And remember P for one more component, that is psammomatous calcification. Okay, for T you can remember it as usually these nucleus, they have a elongated nucleus when compared to normal follicular epithelial cells. So nuclear elongation. So that can be remembered as tall nuclear profiles. The other important feature is presence of thick colloid, which is appreciated in cytology smear. It is called as chewing gum colloid. So you can remember it as T for thick colloid. Okay, lastly, what is most important? The individual cell features with respect to nucleus. So remember it as the chromatin features. So what are the three important chromatin or the nuclear features that you are looking for? Very, very important. Optically clear nucleus, which is an orphan Annie nucleus. The second thing is intranuclear cytoplasmic inclusions or the INCIs, which are eosinophilic in nature. And lastly, the intranuclear grooves. Presence of these things will usually give a diagnosis of papillary carcinoma. So even in the absence of papillae, if you see these nuclear features, they are very diagnostic of papillary carcinoma of thyroid.